Good morning, everyone, and a very warm welcome to this event today. I'm Jan Wiliams, the Chair of Public Health Wales, and it's my privilege and pleasure to be your chair for the day. Before we begin the proceedings, I'd like to ask that we remember Jean Beard, who will have been a loved and respected colleague of many of you, and who sadly died in January. Jean had a long illness, as many of you will know, and throughout it she battled bravely, but she never lost her commitment to the service, and she maintained her inspiring leadership role until she retired at the end of December. So could I ask you please to stand for a minute's silence in Jean's memory. Diolch yn fawr iawn. You'll know that today we are looking at sexual health services in Wales, sexual health in Wales for the present and future generations. And in my briefing pack, I've been given the sort of history of the development of the service over the last 100 years and just seen how far the service has come and how services have really been transformed in this first century. But today is about the next 100 years, what technological advances will be happening, what are the threats that will have to be managed, what are the educational opportunities, what are the societal implications, and how is the service actually going to provide the vision for the future, for the population of today's Wales and tomorrow's Wales. So I'm certainly looking forward to learning a lot about your plans as the day goes on. So it is now my great privilege and pleasure to introduce our keynote speaker, who will be known to you all, Dr. Frank Atherton, who is the Welsh Government's Chief Medical Officer. We're delighted that Frank has been able to take time out of what is a very busy schedule for him to be with us this morning. So please give him a very warm welcome.
Well, thank you very much, Jan, and good morning, everybody. Bore da. Great to see lots of service professionals here. One of the great delights of being a chief medical officer is I very often find myself in a room talking to people who know vastly more about the subject in hand than I do. But one of the good things for me about today is that actually when I think about my career in public health and in medicine, there's a theme that has followed me, and it's been a theme around sexual and reproductive health. In fact, I trained as a GP, longer ago than I care to think, but I very soon became interested in international health and public health, and I worked in Malawi, as some of you will know, with voluntary service overseas for a couple of years as a district medical officer, and it was that experience really which gave me my first exposure on a global level to some of the challenges around sexual and reproductive health, and it was that converted me actually from a GP, from a provider of medical care, to a public health practitioner, because when I looked at the causalities of maternal mortality in developing countries, I mean, it was clear that if we are able to provide girls and young women with gender equity, with education, with access to contraception and family planning services, with good transport systems and with basic obstetric care, then we're able to avoid all of the problems that I used to see as a medical officer pouring into the hospital that I was running. So sexual and reproductive health is a really important theme to me, and I'm very appreciative of the work you do. One of the the other kind of issues for me as a chief medical officer is they tend to lock me in a box often in Cardiff, and I sometimes struggle to get out. So I'm always looking for opportunities to come and see good quality services. And so I know my team will be horrified for me to say this, but I'm always curious. So if you have kind of places that you think I should come and have a look at, I'd like to make that offer to come and see some sexual health services in practice here. That theme of sexual and reproductive health has continued through my career, and when I came back into the UK to retrain in public health, and the way I did that I'll describe in a moment, because there are parallels, I think, between public health and sexual health in many areas. I became very interested in the area of assisted reproduction, and I did some work on needs assessment around IVF and reproductive health services. So today I see as a continuation of my interest in sexual and reproductive health, and I recognize the environment has changed a lot since then. Now, another part of my job as Chief Medical Officer, I get to chair various boards, and so I was pleased when the previous Minister for Public Health here in Wales recognised sexual health services as an important area that we need to understand better and we need to develop more. And she asked me to create a programme board, and I've been chairing that for the last year or so, and we've been trying to look at the priorities for sexual health across Wales. I'm not going to talk about the detail of that. Giri is going to talk about some of that in a moment. But it's been a great pleasure to work with gifted, talented professionals across Wales and to hear the experience of frontline staff and the challenges that you face, because those are the challenges we need to address. One of the challenges that I've been bringing really to that group, to the programme board, has been that we really have to base all of everything we do on good, solid evidence. And we do have a lot of evidence about what works around sexual health agenda, for sure, but we sometimes make mistakes, and I look back, over the things that have happened perhaps in the UK, and I think about, chlamydia screening sometimes, and whatever you think about that, I was quite pleased when I came to Wales to see that we hadn't gone down the same route of screening all young people aged 16 to 24 for chlamydia, because I was never really convinced that would change the population prevalence. It's just one case in point, and we can debate the pros and cons of that, but it's one case in point that we need to be very evidence-based. And we're going to hear from Public Health Wales quite soon, I think, about some of the evidence about what works and what works well. The other big challenge for us, of course, in Wales is to deliver an equitable service. We need to look at who is benefiting from the services we provide, but we also need to think, well, who is not accessing those services? And that's true in sexual and reproductive health services more than in many other services. And so I'm particularly keen, with an interest on, my personal interest in inequalities, to understand some of those questions. So I look forward to hearing more about that as we go forwards, and perhaps getting your reflections on the day. What we do know is that, sexual health services, I recognise, are under pressure. There's no doubt about that. The NHS, the health service, generally is under considerable pressure. It's rare to have a day when we don't have a news story about the NHS, particularly as we go through the winter months. And we know that the number of people coming through for sexual health services is increasing year on year on year, and that some services are struggling to keep up with that demand. So part of the challenge for us as Welsh Government and as the NHS is to think about, well, how do we match the demand to the need that is clearly out there? I've already mentioned, some of the concerns that I have when I look at the review of sexual health services. Clearly one of them is about inequalities and who's benefiting, who's not benefiting. When I look at our termination of pregnancy services, I recognise the need to modernise and to update those as well. But those pressures on the NHS, they do affect us in the sexual health world. We know that the NHS is subject to pressures because of the demography. I'll talk a little bit more about that in the context of sexual health in a moment. But so demography is changing. We know that new technology brings benefits, brings huge gains to us, but it also comes at a cost. And we know that the public's expectations are also rising constantly. And so we do need to think about how within sexual health services we meet those three challenges from the parliamentary review. And when I think about the new technologies, they've really revolutionized, I think, a lot of what we do in sexual health. You know, if we think about hepatitis C and the opportunities of hepatitis C and HIV and the processes that we now have in place for testing, for near-patient testing, for point-of-care testing, and for treatment. You know, the new directly acting antivirals in hepatitis C have been a game changer. We know that. So new technologies bring huge benefit to our patients, but they come at a cost, and we need to think about how we afford them, how we build them in, and where and when we build them into our sexual health services. I'm very conscious that we're seeing a rise of STIs. We talked about the demand, the changing demand and the changing demography. So, you know, I'm very conscious we are seeing an increase in sexually transmitted infections. I worry about that for two reasons. I worry about the demography again. I worry about the changing societal patterns of disease transmission and the fact that many older people are now suffering from STIs. That's an issue we need to grapple with. But I also think about the kind of the changing societal changes. And my previous job, of course, I was working in Canada, in Nova Scotia, and we saw the same kind of patterns of gonorrhea transmission that you've been seeing in Wales and across the UK, of small outbreaks driven largely by social media contacts, you know, and mapping those and dealing with these new challenges that we face in sexual health services is really, really important for us as we go forwards. So lots to go at there. Two things, though, that will remain the cornerstone of what we do. Well, perhaps three. You know, prevention is really, really important. I'm a public health physician now, I've told you that. And so prevention and thinking about how we work with populations, how we support populations to prevent sexually transmitted infections in particular, to prevent early teenage pregnancies, etc., is really, really important. So prevention is a cornerstone. Early diagnosis, getting people into treatment, into testing earlier is really quite key. And the third one I would mention is that, you know, primary care and community care services being the bedrock of what we do for people with sexual health needs is really important. So, you know, I'm not here to be gloomy. There are big challenges ahead for us, but we do need to perhaps think back to the past and to some of the progress that we've made. You know, when I started work in Malawi, and you know, it was back in the early 90s, late 80s, early 90s, and HIV was just coming on the scene. It had only really recently been, you know, the causal agent had just been discovered, really. We were seeing large numbers of people in Malawi coming into the hospital. We didn't have any treatment. There were no antiviral agents available. Massive amounts of co-infection with tuberculosis, of course. People were just dying. Families were being left abandoned. Children were being orphaned. So it was a really, really, really difficult time. And you know, at that time in the international world, the thought was, well, antivirals, which were just perhaps starting to come on the scene, you know, towards the end of my time there, were too expensive. There was no way of funding those for particular disadvantaged populations in poorer parts of the world. But look at where we are now. Look at what has changed. You know, the antivirals are working. HIV is seen as a chronic disease as opposed to a fatal disease. Access is much, much better. But we still have challenges. Even here in Wales, we still know that, well, we estimate that about 10, 11% of people with HIV are undiagnosed still. I mean, that's improving. It was, what, 20-odd percent, 24% back in 2012. So it's improving, but we still have a way to go in terms of encouraging people to come forwards for testing, for reducing the stigma so that they can do that. So we need to build on our successes. The other thing which has happened just in the last year or so, of course, is that we have introduced, the Cabinet Secretary announced pre-exposure prophylaxis just about a year ago, and so we've been piloting that, and I know we're going to hear more about that, but that's a great thing for Wales. It means that we are at the front, at the cutting edge of some of the services some of the service changes that we need to make here. So I'm quite proud, and I think that's to our advantage, and I look forward to hearing more about that later this morning, perhaps. I've already talked about hepatitis C and the change in hepatitis C. I've been a bit skeptical in the past about hepatitis C, about whether the antivirals, you know, will have a curative will be truly curative, because we know they lead to we need to sustain virological clearance. Do they actually lead to long-term health benefits over 20, 30, 40 years? Only time, of course, will tell. But for sure, they have been a game changer. They do offer the prospect, at least, of cure, and people are accessing them. But again, we know that there are people out there with hepatitis C who are not coming forwards for testing, and so the service is available. It's fantastic that Wales is probably one of the only countries in the world where the pool of prevalence of people we know who have hepatitis C is pretty much receiving or has received treatment. That's great news. One other thing I just want to say is that we do need to think more in the world of sexual health practice than in some of the other areas that I get involved with about discrimination, because it still exists and there is still shame and stigma attached around some of these diseases. And working with the population, communications is a really important strand for us, and we do need to think about how we communicate better with the public around sexual health in a positive way. So, I said I would just reflect a little bit on the synergies between public health and sexual health, and there is one synergy, and it's that they tend to be, we often think about sexual health, mental health and public health as being the kind of neglected subject. There's the Cinderella areas, and I know we sometimes feel that way. What I would say to you is that, my experience has been that often a crisis can change things, certainly in public health terms. And I think that's perhaps true in sexual health as well. The changing demography, the new technologies. I think they do provide us with a platform on which we can build a strong case for investment and for support to better sexual health services. So I don't want to see sexual health services as a Cinderella service. I'd welcome your views on that as to whether it feels like that. It always used to be said, but does it still feel like that? So in summary, I think we've got some big opportunities. We've got new technologies at our fingertips and coming on stream as well. We do need to tackle our changing demographics. We do need to look carefully at the epidemiology, which is changing as well, and we're going to hear more about that this morning. I'm very optimistic about the future. I'm optimistic because when I look around the room, I see enthusiasm, and I know it exists, and those services I have been to, and I'd like to visit more of them, as I said, but I see real dedication, hard work, and enthusiasm for providing good services to the people of Wales, which is what, after all, we're all about. Thank you.